Hi, my name is Guardado, and this is my video presentation and assessment 1 for Nurse FPX 4010. In this video, I'm using a real life story of something that happened to me during one of my shifts a little over a week ago. Actually, this situation was the inspiration for all the assessments of this course. Throughout this video, I will reflect on an interdisciplinary collaboration experience, noting ways in which it was successful and unsuccessful in achieving desired outcomes. Explains outcomes of the collaboration that help the team make progress towards the relevant goals or outcomes. Explain aspects of the collaboration that could have been improved. Identify how poor collaboration can result of inefficient management of human and financial resources. Discuss the way in which of the interdisciplinary teams did not collaborate effectively. Discuss the negative implications for the human and financial resources of the interdisciplinary team and the organization as a whole. I will also identify best practice leadership strategies from the literature that will improve an interdisciplinary team's ability to achieve its goal. Identify at least one leadership best practice or strategy that you believe will improve the team's ability to achieve their goal. And also identify the strategies and its source or author and provide a brief rationale choosing the choice strategy. During one of my last shift, I was precepting a future nurse for the floor. And we had this patient that she was a very nice and elderly woman that it was super, super, super sweet. We actually helped her a lot. We did all the labs around the unit to measure her oxygen levels, to identify the needs for the oxygen at home, because she kept insisting that at home she uses a different oxygen level that we were using in the unit. She was also complaining about the meal delivery times, how it was not at all scheduled properly. And there were a lot of issues, but that was within the entire hospital situation. It was not us at the unit side. It was not a nursing per se problem. Other than that, she was also scheduled to have an echo, which it didn't happen that day. And then you'll see what happened after. So towards the end of the shift, we were like playing with her. We were telling her that she can dance cha-cha-cha because she was so like happy. And for being an elderly woman, she actually moved very well and able to walk with a cane, not with a rolling walker. She said she didn't feel the need yet for a rolling walker, and we actually praised him for that. So she was a very special elderly woman, and the nurse that I was precepting and I make sure that she get all her needs covered. Towards the end of the shift, I told her, look, meals hasn't come in. It's 6:47. I don't know what's going on. I had to give report. I came and I introduced the new nurse and everything. The new nurse told her, the night shift nurse told her that she was going to provide her all the insight, like to see what's going on with the food. But the food was actually just arriving to the floor. So we knew that the kitchen closes at 7, but I had to give report to 5 other nurses because that day was a hectic day and we have 5 patients in total. And then I was giving report and she was like, yeah, sweetheart, don't worry, go give your report. You worked really hard today. You guys deserve a break and you're coming back tomorrow, so you have me again and everything else. So we went and I told her, the echo still scheduled for today. They haven't canceled it. Let's wait. Hopefully they don't cancel it. If they cancel it, I'm assuming that they will let the nurse know, so then you find out. I don't have control of that. I'm just letting you know. And the nurse agreed, and then I left for the day. The next day, I actually requested to have the same 5 patients, and the nurse told me, "Oh, I don't know if you want to go to that room right now." And I'm like, "What happened?" And then she says, "Oh, she's very upset at you." And I'm like, "At me?" I left and the situation was perfectly clear. Everything was fine. She says, "No, no, no, no. Right now, she's very upset at you because you didn't do your job." And I'm like, "I didn't do my job. Excuse me." And my manager came and told me, "Honey, have you done anything differently for this patient?" And I'm like, "No, I actually," and I gave her all the timeline of what happened with the patient the day before, when did the meal arrive to the unit, the time that arrived to the unit, the time of the distribution, and the time that I actually introduced her to the patient, to the new nurse for night shift, and then that's it, I have to go. And then the night shift nurse started saying, "Oh, she's upset because she says that you dropped the ball because you should have called echo to see why there is a delay." Then my manager says, "That's not nursing, that's echocardiogram. We don't control that." I'm like, "Exactly." She was upset because her tray didn't come in. I'm like, "That's not nursing. That's also not me. So why is she mad at me?" Also, she's mad because the doctor prescribed a medication around 3 o'clock and you didn't give her the notification that the medication was going to be due and you had to give it to her. And I was going to give it to her at nighttime. I'm like, again, that's not nursing. That's the doctor that should have discussed the medication with her, and the medication was not given during my shift. So I don't have to talk to the patient about something that is going to happen in the future, because if it doesn't happen, then it's a problem for me as a nurse. Then I'm lying to the patient, so I'm not getting into that. My manager agreed, and we both went to see it. The patient was completely aggravated, extremely aggravated. It was a situation that I was like, I'm proud of myself because I'm very good at customer service, not for nothing. But I was like, "My love, what happened?" "No, my meal didn't came." And then she started complaining again. And I'm like, "Well, but that's not me. Unfortunately, I don't have to do with this." And the way that I see it is that the night nurse, instead of making sure the patient was, because the patient wanted to even leave AMA, and she couldn't leave AMA because she needed that echocardiogram. So we were like, "Look, I guess the night nurse didn't know how to control the situation, and instead of blaming the other agencies, she continued to agree with the patient on blaming the nurse." The manager has to actually interject and say, "Look, the nurses are not the one that prescribe the medication, it's the doctor. Nurses are not allowed to talk about medication unless the doctor gives you the first information about the medication," which I'm assuming the doctor did. Nurses do not control the meal time, and nurses do not control any echocardiogram, any type of test that you're going to go during the shift. Nurses don't control that, especially when it's a different agency. So we concentrated more on the meal time. We agreed that it was the meal that actually upset the patient at that point, and that was the situation that started aggravating the rest. The echocardiogram was tested at 10:45 for the next day was scheduled, and my shift was perfectly fine. I was talking to the lady was completely sweet with me. I was able to get her back to her initial way of being with me, and then we agree that the managers needed to talk more about the communications between agencies within the hospital, because and this is how I arrived to this conclusion. With the efficiency of the meal delivery, you get a lot that needs to be done before that meal gets to the patient. But by controlling that, you actually can de-escalate any situation and also can help patient satisfaction. So like the way that I see it is that efficient meal delivery is crucial in healthcare setting for several reasons. Number one is the patient health. Timely access to nutritious meals is essential for patient health and recovery. Proper nutrition supports healing, help maintain energy levels, and can prevent complications related to malnutrition or inadequate dietary intake. For patients, for example, with specific medical conditions or dietary requirements such as diabetes or dysphagia, timely access to appropriate meal is even more critical for managing their health effectively. Patient satisfaction is another area. Meal delivery is an essential aspect of the overall patient experience during a hospital stay. Delays or errors in meal service can lead to frustration, dissatisfaction, and even anxiety among patients, which I think that's what happened with my patient. Conversely, prompt and accurate meal delivery contributes to a positive patient experience, enhancing their comfort and satisfaction with the care received. Clinical outcomes. Nutritional support plays a significant role in clinical outcomes, including recovery times, complication rates, and overall treatment success. Patients who receive timely and appropriate nutrition are more likely to experience positive outcomes and may have shorter hospital stays compared to those who experience delays or interruptions in meal deliveries. When it comes to interdisciplinary collaboration, efficient meal delivery requires coordination and collaboration among various healthcare professionals, including dietary staff, nursing teams, physicians, and allied health professionals such as speech therapists or nutritionists. Addressing these challenges related to meal delivery promotes teamwork and communication among these disciplines, fostering a culture of collaboration within the healthcare system. Risk management. Delays or error in meal delivery can pose risk to patient safety, such as medication interactions or complications arising from missed meals or for diabetic patients. By optimizing meal delivery processes and ensuring timely access to meals, healthcare facilities can mitigate these risks and prioritize patient safety as a fundamental aspect of care delivery. And this is all. Thank you.